After studying this module, you shall be able to learn about the major symptoms of the Parkinson's disease, learn to differentiate between Parkinson's and Parkinsonism plus disease, learn how to diagnose the disorder, understand the causes of the disease, and learn about the treatment and prognosis of the disorder. Parkinson's disease is also known as idiopathic or primary Parkinsonism, hypokinetic rigid syndrome HRS, or paralysis agitans. It is a degenerative disease of the central nervous system. It is slowly progressive disease and largely affects older people. Earlier stages of the disease are marked by motor disturbance, while the later ones have dementia as well. The disease is marked by degeneration of dopaminergic cells in the substantia nigra region of the brain. Normally, these cells make an important chemical called dopamine. Dopamine sends signals to the part of the brain that controls movements. It lets muscles move smoothly and do what one wants them to do. In Parkinson's disease, these nerve cells break down the neurotransmitter dopamine. With the lack of dopamine, the motor behavior is adversely affected. Parkinson's is progressive, which means it gets worse over time, but usually this happens slowly over a period of many years, and there are many good treatments that can help one live a normal life. Parkinson's disease is often defined as Parkinsonian syndrome, that is idiopathic, which means having no cause, although some atypical cases have a genetic origin. Brain areas and neurotransmitters in Parkinson's disease. Parkinson's disease (PD) was first described extensively by an English doctor, James Parkinson, in 1817. Today, it is understood as a disorder of the central nervous system that results from the loss of cells in various parts of the brain, including a region called the substantia nigra. The substantia nigra cells produce dopamine, a chemical messenger responsible for transmitting signals within the brain that allow for coordination of movements. Loss of dopamine causes neurons to fire without normal control, leaving patients less able to direct or control their movement. Parkinson's disease is one of the several diseases categorized by clinicians as movement disorder. The exact cause of Parkinson's disease is unknown, although research points to a combination of genetic and environmental factors. Neuropathology of Parkinson's disease. The neuropathology of the disease is characterized by accumulation of a protein called alpha synuclein into inclusions called Lewy bodies in neurons. It results in insufficient production and activity of dopamine produced in certain neurons within parts of the midbrain. Lewy bodies are the pathological hallmark of the idiopathic disorder, and the distribution of the Lewy bodies throughout the Parkinsonian brain varies from one individual to another. The anatomical distribution of the Lewy bodies is often directly related to the expression and degree of the clinical symptoms of each individual. Parkinson's disease is marked by a degeneration of dopaminergic cells and pigmentation in the substantia nigra, which is a black substance. It is also characterized by Lewy bodies, which are small, tightly packed granular structures with ring-like filaments found within dying cells. Although neurodegeneration and Lewy bodies are pathognomonic markers in cells of the substantia nigra, patients with PD may also have concentrations of them in other pigmented subcortical areas such as locus coeruleus or unpigmented areas such as nucleus basalis or minute, hypothalamus, cerebral cortex, cranial nerve, motor nuclei and the components of autonomic nervous system. Although the pattern of concentration of Lewy bodies in the brain is not specific to PD, they may also appear in normal aging people and those with other progressive neurodegenerative conditions. The loss of dopamine from substantia nigra is directly related to the problems of movement, initiation and motor rigidity in PD. Aging itself takes a toll on the dopamine system and some cells loss is expected, but the dopaminergic degeneration in PD is several times that of normal aging. Causes of Parkinson's disease. The links between Parkinson's disease and factors such as genetics, aging, toxins in the environment and free radicals are all under investigation. Genetic causes. In the past 10 years, researchers have identified a number of rare instances where Parkinson's disease appears to be caused by a single genetic mutation. In these cases, the mutated gene is passed from generation to generation, resulting in a great number of Parkinson's disease cases within an extended family. Mutations in the LRRK2 gene are the greatest genetic contributor to Parkinson's disease discovered to date. Environmental causes. On the opposite end of the continuum, in the early 1980s, a group of heroin users in California took drugs from a batch contaminated with a substance called MPTP. After ingesting this chemical, the drug users were stricken with a form of Parkinson's disease that was primarily, if not exclusively, environmental in origin. Combination of both genetic and environmental causes. For most Parkinson's patients, the cause lies somewhere in the middle, while many Parkinson's patients report one or more family members having the disease. It is always clear that one or several genes are the cause. Similarly, while some patients suspect that exposure to one or another chemical or environmental toxin caused their Parkinson's disease, this also cannot be conclusively proved. Scientists currently believe that in the majority of cases, genetic and environmental factors interact to cause Parkinson's disease. Research into this subject continues. Unfortunately, however, it is almost impossible to determine what specifically caused a given individual's Parkinson's disease. Other risk factors. Because if causes of Parkinson's disease are unknown, there is no scientifically validated preventive course to reduce the risk of its onset. The single biggest risk factor for Parkinson's disease is advancing age. Men have a somewhat higher risk than women. A number of studies have highlighted factors that are associated with either greater or lesser risk of Parkinson's disease. For example, smoking and caffeine consumption have been associated with lower rates of Parkinson's disease, while head injury and pesticide exposure have been associated with higher risk. While such studies do not definitely link these factors with Parkinson's disease, one way or another they highlight areas where further research may guide us to discover prevention or treatment. Symptoms of Parkinson's disease. The motor symptom of Parkinson's disease results from death of dopamine generating cells in the substantia nigra, a region of the midbrain. The cause of this death is unknown. Early in the course of the disease, the most obvious symptoms are movement related. These include shaking, rigidity, slowness of movement, and difficulty with waking and gait. Later, thinking and behavioral problems may arise, with dementia commonly occurring in the advanced stages of the disease, whereas depression is the most common psychiatric symptom. Other symptoms include sensory, sleep, and emotional problems. Parkinson's disease is more common in older people, with most cases occurring after the age of 60. The main motor symptoms are collectively called Parkinsonism or Parkinsonian syndrome. The four major symptoms of Parkinson's are tremor, which means shaking or trembling. Tremor may affect your hands, arms or legs, stiff muscles, slow movement, problems with balancing or walking. Tremor may be the first symptom one may notice. It is one of the most common signs of the disease, although not everyone has it. Most importantly, not everyone with a tremor has Parkinson's disease. People usually start to have a symptom between the ages of 50 and 60, but in some people symptoms start earlier. Tremor. It is often the first symptom that people with Parkinson's disease or their family members notice. Initially, the tremor may appear in just one arm or leg or only one side of the body. The tremor may affect the chin, lips and tongue. As the disease progresses, the tremor may spread to both sides of the body, but in some cases, the tremor remains on just one side. Emotional and physical stress tends to make the tremor more noticeable. Sleep, complete relaxation, and intentional movement or action usually reduce or stop the tremor. Stiff muscles or rigidity. It is accompanied with aching muscles. One of the most common early signs of Parkinson's disease is a reduced arm swing on one side when the person is walking that is caused by rigid muscles. Bradykinesia. It is characterized by slow and limited movement, especially when the person tries to move from a resting position. For instance, it may be difficult to get out of a chair or turn over in bed. Weakness or facial muscles. It is also accompanied with the weakness of throat muscles. Talking and swallowing may become more difficult. Speech becomes softer and monotonous. Loss of movement in the muscles in the face can cause a fixed, vacant facial expression, often called the Parkinson's mask. Postural instability. There is difficulty in walking, gait disturbance, and balance, postural instability. A person with Parkinson's disease is likely to take small steps and shuffle with his or her feet close together, bent forward slightly at the waist, stooped posture, and have trouble turning around. Other symptoms: Parkinson's disease can cause many other symptoms. These can be disabling and may include decreased dexterity and coordination. Changes in handwriting are common, with writing becoming smaller. Athletic abilities decline, and daily activities such as dressing and eating become harder. Cramp in the muscles and joints, oily skin or increased dandruff, digestive and urinary problem. Constipation is common. Controlling urination may be difficult, and urination may be frequent and at times urgent. Problems with involuntary or automatic body functioning such as increased sweating, low blood pressure when the person stands up. It is also known as orthostatic hypotension, and problems with sexual functioning. These symptoms may also be caused by Parkinson's plus conditions or drugs used to treat Parkinson's disease. Freezing, a sudden brief inability to move. It most often affects walking. Problems with sleep, mood and thought also are common in people who have Parkinson's disease. Problem falling asleep or staying asleep, insomnia, can result from anxiety, depression or physical restlessness. People with Parkinson's disease may not be able to sleep well because they cannot easily turn over or change position in bed. A person with Parkinson's disease may slowly become more dependent, fearful, indecisive and passive. The person may talk less often than he or she used to, withdraw from family and friends, and remain inactive unless encouraged to move about. Depression is very common in people with this disease and can be caused by chemical changes in the brain, or can be a reaction to having a disabling disease. Depression often improves with proper treatment. Up to 1/3 of people with Parkinson's disease may develop dementia and confusion similar to Alzheimer's disease late in the course of the disease. Depression can further contribute to memory loss and confusion. Memory loss, hallucinations, seeing or hearing things that aren't really there, and vivid dreams may sometimes be caused by drugs taken to treat Parkinson's disease. There are many other conditions with similar symptoms. Some of these may be reversible. Treatment may help control symptoms during the early stages of Parkinson's disease and is usually started as soon as symptoms begin to affect a person's ability to work or do daily activities. As the disease progresses, drugs may become less effective. Parkinson's disease also can cause a variety of other symptoms as it advances possible complications. Difficulty performing daily activities, difficulty swallowing or eating, disability differs from person to person, injuries from falls, pneumonia from breathing in aspirating saliva, side effects of medication. The motor symptoms of Parkinson's disease generally fall into groups of positive and negative symptoms. Positive symptoms indicate an excess of motor behavior or abnormal motor reactivity, whereas negative symptoms indicate a diminution or loss of motor functioning. Some experts believe that the negative symptoms may manifest before the positive symptoms, although they may be frequently missed. Positive symptoms include resting tumor, rigidity, stoop posture, impaired writing, or reflex, poor balance, and negative symptoms includes bradykinesia, slowness of movement, hypokinesia, reduced motor initiation, gait disturbance, fascinating rapid small steps, masks faces reduced facial expression, slowed speech and decreased voice amplitude. Cognitive deficits associated with Parkinson's disease. Memory is adversely affected in Parkinson's disease. In Parkinson's disease, patients show a recall deficit but demonstrate encoding and registration of declarative material through recognition tasks. Non-declarative learning presents a mixed bag in PD. Verbal priming and perceptual motor adaptation are largely unimpaired. The ability to learn new things decline as disease progresses. Procedural learning may be deficient. At times, patients with PD perform poorly because of a problem in maintaining mental set for the rule. Again, pointing more to a problem in executive functioning than to a memory registration problem. Most of the memory problems experienced by patients stem from interactions among the executive, the memory registration and the motor systems. Language and speed deficits also accompany advanced stages of PD. The disorder does not produce classical aphasia. Also, few, if any, linguistic impairments appear. Grammar and sentence structure, thus general language processing and comprehension are intact. Patients with PD lose voice amplitude and vocal emotional expression, diasphonia, which results in monotonous voice. Other speech irregularities may include segmented accelerated bursts of speech, tachyphemia, and compulsive word or phrase repetition, palilalia. Executive functioning is one of the functions that is badly affected in the disorder. Many patients with PD have executive functioning difficulties. Difficulties with specific executive functions can be evident, although most do not have difficulty with abstract thinking. These deficits show up early in the disease process and thus appear to result directly from the disease. Patients with subcortical dementia majorly face difficulties with changing mental sets, maintaining mental sets and temporal structuring. The inability to switch mental set in response to environmental demands or perseveration shows most clearly on neuropsychological testing through measures that require strategy shifts to solve problems, such as Wisconsin card sorting test. Someone who has set shifting problems repeatedly tries to use same strategy even if it is not working. Investigators have found that patients with PD do not make errors on these types of tasks, but the errors to make are preservative. Another cognitive factor which is evident in the visual spatial functioning. In Parkinson's disease, most patients perform poorly on spatial tasks that have motor components. Different patients may have somewhat different pathology and thus different clinical presentations. Those with more left-sided motor impairment may show more right hemispheric damage, visual spatial deficits. Patients have difficulty in orienting themselves in space. Visual spatial motor aspects link in an overall spatial framework. Disease could theoretically disrupt this network in the parietal lobes or anywhere along the visuomotor symptom. Some investigators have suggested that the basal ganglia play a role in the visuomotor aspect of visuospatial problems in patients with PD. Mood, emotion, personality, and insight changes have been observed in PD patients, particularly in the advanced stages of the disorder. A large number of patients with PD suffer from depression. debate continues whether the mood disorder is a primary dysfunction of the disease or a secondary result of medications used to treat the disease. Patients with PD appear to be more depressed than patients with any other chronic disease. Diagnosis of Parkinson's disease. Parkinson's disease can be difficult to diagnose in its early stages. Doctors base their diagnosis on the patient's medical history and symptoms evaluated during a neurological exam. No laboratory or imaging test can diagnose Parkinson's disease, although brain scans such as CT or magnetic resonance imaging or positron emission tomography may be used to rule out other neurological disorders. Medical history. A medical and personal history should include any relevant symptom as well as medications taken and information on other conditions the patient may have. Neurological examination. In a neurological examination, the doctor will ask the patient to sit, stand, walk and extend arms. The doctor will observe the patient's balance and coordination. Parkinson's may be suspected in patients who have at least two of the following four symptoms, especially if they are more obvious on one side of the body: tremor, when the limb is at rest, slowness of movement, bradykinesia, rigidity, stiffness or increased resistance to movement in the limbs or torso, poor balance, which is postural instability. Drug challenge test. A levodopa challenge test may confirm a diagnosis of Parkinson's disease. If a patient's symptoms improve when they take levodopa, they likely have Parkinson's, ruling out other neurological disorders. Tests for depression and dementia. The American Academy of Neurology (AAN) recommends the Beck Depression Inventory or the Hamilton Depression Rating Scale to screen for depression in patients with Parkinson's disease. The AAN recommends the Mini Mental State Examination (MMSC) and Cambridge Cognitive Examination (CAM-COG) test to screen for dementia. During these tests, the patient answers a series of questions. Conditions that mimic Parkinson's disease. Parkinsonism plus syndrome. Parkinson's disease is the most common type of Parkinsonism. Parkinsonism refers to a group of movement disorders that share similar symptoms with Parkinson's disease but also have unique symptoms of their own. Their symptoms include corticobasal degeneration. It is marked by apraxia, inability to perform coordinated movements or use familiar objects, stiffness that is more severe than typical Parkinson's disease, and twitching or jerking in the hand. Lewy body dementia. It is one of the most common types of prognosis dementia. Symptoms include visual hallucination and loss of spontaneous movement. Multiple system atrophy. Symptoms include fainting, constipation, erectile dysfunction, urinary retention and loss of muscle coordination. Progressive supranuclear palsy (PPS). It is marked by frequent falls, personality changes and difficulty focusing the eye. Patients with PPS often have earlier and more severe dementia than those with Parkinson's disease. In addition, they do not usually respond to medications that are used to treat Parkinson's disease. Many other medical conditions may cause some symptoms of Parkinson's disease and Parkinsonism. Hardening of the arteries. Arteriosclerosis in the brain can cause multiple small strokes which can produce loss of motor control. Alzheimer's disease can share similar symptoms with Parkinson's and the condition can exist together. Treatment and prognosis. Certain drugs or medications account for some cases of a number of patients. A certain number of drugs can also cause these symptoms, including antipsychotic and anti-seizure drugs. Anyone with Parkinsonism should discuss their medications with their doctor. There are no laboratory or blood tests that can help us know about Parkinson's, but tests may help us to rule out other diseases that could be causing symptoms. Diagnosis of typical cases is mainly based on symptoms, with tests such as neuroimaging being used for confirmation. There is no precise test for Parkinson's disease. For patients with Parkinson's disease, a PET scan is used to assess activity and function of brain regions involved in the movement. Modern treatments are effective at managing the early motor symptoms of the disease, mainly through the use of levodopa and dopamine agonists. As the disease progresses and dopaminergic neurons continue to be lost, these drugs eventually become ineffective at treating the symptoms and at the same time produce a complication called dyskinesia marked by involuntary rhythm movements. Getting regular exercise and eating a healthy, balanced diet are important parts of treating Parkinson's disease. Exercise can help you keep your strength, coordination, and endurance, as well as control your weight and reduce the likelihood that you will become constipated. Although a balanced diet is important, people who take levodopa should talk to their doctor about when to eat protein, because levodopa may not work well if you take it at the same time that you eat protein. Depression is common in people with Parkinson's disease. Recognizing and dealing with depression is an important part of home treatment. There are medicines that can help the symptoms of depression in people with Parkinson's disease. Diet and some form of rehabilitation have shown some effectiveness at alleviating symptoms. Surgery and deep brain stimulation have been used to reduce motor symptoms as a last resort in severe cases where drugs are ineffective. Medications to treat non-movement related symptoms of PD, such as sleep disturbances and emotional problems, also exist. Untreated, the disorder will get worse until a person is totally disabled. Parkinson's may lead to a deterioration of all brain functions and an early death. Most people respond to medications. How much the medications relieve symptoms and for how long can be very different in each person. The side effects of medications may be severe. Summary: Parkinson's disease is caused by accumulation of protein called syncline into Lewy bodies of neurons, mainly in substantia nigra. Such neurons contain dopamine as the neurotransmitter. Mutation in the gene called LLRKZ is the major genetic cause of it, besides environmental hazards. The major symptoms include tremors, postural instability, bradykinesia, weakness of facial muscles, and muscle rigidity. Depression is the most common psychiatric symptom of the disease. Diagnosis of the disorder includes medical history, neurological and psychiatric examination, and drug challenge test. Drug therapy with levodopa and the other dietary improvements are the suggested treatments. The prognosis of the disease is not very promising. Thank you.